My name is Snehal Patel. I am the CEO and co-founder of MyDoc. So MyDoc is an online provider of care. We provide teleconsultations for users across various markets. We've been providing that service to help transform an offline world into an online universe, as well as provide a transformation from a fee-for-service universe into a value-based care model. We realized that there was a gap connecting consumers to the experiences that they needed from the healthcare community, and we realized that that gap can be filled through an online presence, connecting them to an offline world. And as a result, we feel that companies like MyDoc are actually essential in this new age where we are moving toward chronic disease being a huge burden on families, governments, and others. NTUitive has been part of our company since the very beginning, when we were put in touch by the government through a grant scheme that they had put together for startups. And ever since we've been scaling, we've been able to really get a lot of help and support from the folks at NTUitive as we've grown. The NTUitive MedTech team has been instrumental in us being able to raise capital for our company. They're great at making recommendations, introducing us to various investors, and we look forward to furthering that relationship going forward. We've now scaled to over 80 people across 7 countries, and we have lots of folks that are representative or senior people that had come from the insurance industry, because one of our core sort of go-to-market strategies focuses around insurers that we work with to help provide our services to their users. COVID-19 has really got us to understand what our consumers really need, and we've been able to add additional services during that time, such as mental health counseling and other features that were of acute need during that specific era. Most people have started to see the benefits of teleconsultation primarily during the pandemic by being able to avoid crowded hospitals and clinics where the risk of infection was higher. Post-pandemic, they're starting to really appreciate the convenience that having sort of doctors in your pocket can provide that they did not have previously. We believe that now that COVID-19 is subsiding, that the future of MyDoc is very aligned with the government's transformation of healthcare here in Singapore, where everyone is being exhorted to have their own GP. Being able to layer on a virtual model onto that concept of having your own doctor will be transformational, and we look forward to being part of that journey. Well, as the team progresses, right, I mean, I think the really important thing about founding companies is that it's no longer one person's job. And we have a fantastic team that are coming up with great ideas. And as I get to support them moving forward, I look forward to their sort of contributions and coming up with the next best things for the company. So I believe there are going to be great things that are coming out of the MyDoc team going forward, above and beyond what we have produced today. The great things also about being a founder is being able to see your team come up with the inventions of tomorrow and being able to support them as they follow their passion going forward.